I'm Natasha Smith Thomas. In today's COVID-19 update, we focus on people living with HIV and COVID-19. Minister of Health Dr. Frank Anthony is urging persons living with HIV to protect themselves against COVID-19 by getting vaccinated. During the COVID-19 update on Monday, Minister Anthony noted that this is important because persons living with HIV, especially those not on medication, their immune systems may become compromised and hence they are more susceptible to contracting COVID-19.
It is recommended that persons with HIV take the COVID-19 vaccine because it's going to protect them. The benefits of getting vaccinated far outweighs the risk of being vaccinated. And in some cases, those persons who would have had their immune system being compromised, in some of those patients, it's also recommended that they get a third dose of the vaccine or a booster shot.
Minister Anthony noted that persons can use any of the vaccines available in Guyana, which are being used for the adult population. These include Johnson & Johnson, Sputnik V, Sinopharm, and AstraZeneca. The health minister noted that persons currently taking ARVs, antiretroviral or PrEP, pre-exposure prophylaxis, should not worry about adverse effects of the vaccine as these treatments work differently.
The mechanisms of action are totally different. Vaccines help to stimulate the immune system so that your body can produce antibodies that can fight off COVID-19 virus. Antiretrovirals, they work differently. They interrupt the life cycle of the HIV, and therefore their actions are totally different. And there's no interaction between the two.
Persons living with HIV are advised to follow the recommended protocols that are applicable to the general population so as to guard against contracting the deadly virus. These include social distancing, wearing masks, and proper hand sanitization.
There are lots of hesitancy among the HIV population. They probably have various myths about why they shouldn't be vaccinated. But all the evidence is pointing that they need to be vaccinated. So the first thing that they can do in terms of protecting themselves is to ensure that they go and get vaccinated.
Up to 2019, the estimated number of persons living with HIV in Guyana numbered 8,700. Meanwhile, today there are 3,907 active COVID-19 cases in Guyana. Over the last 24 hours, 59 new cases were recorded. Data also shows a slight decrease of cases in Region 4, but an increase in cases in Regions 3, 2, and 10. There are 107 persons in hospitals across the country, with 72 at the Infectious Diseases Hospital at Liliandal, 24 in the ICU, and 6 maternal cases.
So right now we have, overall, we have 373,398 persons who would have received COVID-19 vaccine. This is the adult population. That's approximately 72.8% receiving a first dose of any one of the COVID vaccines. We also have 231,729 persons who would have been fully vaccinated or they got their second dose. That now accounts for 45.2% of our adult population. And in terms of Pfizer's vaccine, we have been able to administer 26,391 doses. That's 36.2% of that age cohort as first dose, and another 17,379 persons received their second dose. That's about 22.5% of that age cohort.
You were looking at today's COVID-19 update for today, Monday, October 18, 2021. I'm Natasha Smith Thomas. Goodbye.